Always a pleasure to really welcome a tremendous friend, a great mentor to many of us in terms of what does it really mean to be a cancer doctor, and how do you bring, the person, the human that you are, really to work with you. Ed Creagan really is a spectacular resource for cancer patients on many levels, and this year he's going to be speaking with us regarding demystifying your next medical encounter, a look behind the curtain, our life depends on it.
I stand before you with a tremendous sense of admiration and respect. You're survivors, you're resilient, you're durable, you're here, and we would like to hear from you through social media and through internet, because you can touch many lives with your stories. And I'm going to make a guarantee, if we can stay mindfully connected over the next 25 minutes or so, we will leave here with 3 questions that you can bring to your next medical encounter that will save your life or the life of someone you care about. My 3 colleagues who were here a few minutes ago represent the greatest concentration of clinical genomic information on the planet. Peter Drucker was a columnist, and he made the comment, the best way to predict the future is to create the future. And what you've heard from our colleagues this morning is a future that was unthinkable 2 years ago. What's also unthinkable is the tremendous tech support that we have. And if it wasn't for people like Wes up there and also Eric, I'd be here having a stroke. So please join me with a warm round of applause for our colleagues up here. So let's talk about demystifying your next medical encounter. Let me first share with you my email address, because you have an insight, you have a perspective on illness which we on the clinical side don't have. We cannot relate to some of your suffering. So you have the right stuff. Send me an email and tell me that moment of insight that we can share with other patients. Creagan.edward@mayo.edu. I should share with you, I'm an Irish thoroughbred. How many of you have Irish background? It is we who save civilization. Thank you. And also let me share with you my Twitter handle. Twitter has changed everything. To give you an example, there are 6,000 tweets a second, and it's easy to log on, and you need to share your story. And this was just a screenshot of a tweet a while ago, and I didn't do this on purpose. For today, luck is a bad investment. So we need to be proactive and take care of ourselves. Eastern Airlines Flight 401 took off from JFK Airport in the Queens, December 29th, 1972. Let me black the screen. Let me tell you the rest of the story. This was an uneventful flight, and about an hour before landing in Miami, the pilot and the first officer went through the usual acrobatics. Everything was all set, but a red indicator light indicating that the landing gear were extended did not go on. Everything indicated a smooth landing, but that indicator light was blank. The pilot and the first officer were obsessed at that light. They ignored other warnings, such as the autopilot was deactivated, and the plane crashed. And this killed over 200 people in the Florida Everglades. It was clear when the black box was found, the landing gear were extended, the light bulb was blown. Let me tell you the rest of that story. Air France Flight 447 took off from Rio de Janeiro, June 1st, 2009, with 225 people. There were 2 first officers and 2 captains because it was a 12-hour flight. 4 hours into the flight over the North Atlantic, one of the operators noticed that there was a storm on the horizon, so appropriately, the aircraft went higher. When that happened, there was a malfunction of the speedometer because of some icing developments. The speed of the plane was fine, but the speedometer didn't look normal. The pilots and the co-pilots absolutely panicked and did everything wrong because they were obsessed on the speedometer, and they did not realize that the plane was dropping like a rock out of the sky. So they were hyper-focused on one thing, and they missed some important signs. So I'm going to share with you what we need to do to make sure that does not happen when we have our next medical encounter, and this is what happened. So when the black box was found, it was clear that the pilots over-responded and did not do the right thing because they were hyper-focused on one dial. Hyper-vigilance. And here's a picture of the cockpit. Anybody recognize this gentleman? Mariano Rivera, the greatest closer in the history of baseball, with a pitch that everybody knew was coming and no one could hit it. And this was called the splitter, and would basically be coming at your face at about 100 miles an hour. Everybody knew it was coming, but nobody could hit it. So he was at the height of intensity in baseball, and he did well. Now, why did he do well? Because he had a composure and grace in the gritty, chaotic world of Major League Baseball. And as one of our colleagues mentioned a few minutes ago, many of you are allocated just a few minutes with your doctor. So what do we have to know about baseball and these airline crashes? Now, let me share with you a CAT scan of a patient's chest. And I want you just to work with me as we count some of these white spots. Okay, there's a spot here, all right? There's a spot here. There's a couple of spots over here. So if we add up all the spots, there are about 6 things. But I want to show you the rest of the story, and I want to ask you, did anybody see anything at the top of the left lung? There's a gorilla in the chest. This was shown to several hundred board-certified radiologists. They were asked to count the spots. They did. Half of them missed the gorilla on the x-ray. So if we're hyper-focused, we're going to miss something that's important. Now, David Copperfield is a tremendous illusionist, and if you see his show, you walk out and you don't know what reality is. But we better know what reality is because our life hinges in the balance. Now, once upon a time, there was a paper electronic record. So if Dr. Mesa saw a patient, he would write his notes, which were amazingly legible. And let's suppose Dr. Bryce then saw the patient, he would write his notes. And if I saw the patient, I could thumb through the record and see what their thought processes were. Today, that's not true. We have the electronic medical record, and what happens is that the initial notes are pulled forward, and we become prejudiced by someone else's opinion. Prejudiced by someone else's opinion. So let me share with you where we go with this. This is a chest x-ray of a patient from another city, and black is air on the chest x-ray. And at the bottom of the left lung, there is a spot which was biopsied as showing cancer. And the patient also had some lymph nodes behind the breastbone, which were contaminated with cancer. This is called stage 3 disease. And the initial reaction was stage 3 cancer, lymph nodes involved. This patient demands aggressive chemotherapy and radiation. So that was the knee-jerk reflex. But then an astute clinician looked at the biopsy report. Let me just share this with you. It says a small focus of well-differentiated adenocarcinoma with some growth patterns. What this means is that this was a slow-growing cancer. It was indolent and it was quiescent, and this patient did not need aggressive treatment right off the bat. Now, through Dr. Bryce and his colleagues, at some time, we will have a genetic fingerprint that will help us. But basically, someone took the time to look at the biopsy report, which indicated we did not have to jump in with aggressive treatment. So we need that concerned Marcus Welby, who's our advocate. Now, let's quickly shift gears. I thought this was brilliantly clever. Dr. Mesa said, show the gear shift, they will love you. And I'm up here having a seizure because you're looking at me like this is dumb. So we'll move right along. A couple of years ago, I saw a patient from Wisconsin. This is a wonderful woman. And in 1996, she had blurry vision. She went to see an eye doctor, and he was concerned about malignant melanoma at the back of her eye. Now, traditionally, what often happens is that cancer will appear in the liver 15 or 20 years after the eye is removed. For some reason, it goes right to the liver and no place else. So the patient went to see the local oncologist. He did appropriate studies, and he said, "You have disease in both lobes of the liver. We need chemotherapy." She had some chemotherapy, very sick because there was no genetic fingerprint. Family was not particularly satisfied. They went to a major cancer center, and again they were told, "You have cancer in your liver. We have to do aggressive chemotherapy." So let me just share with you quickly what a scan of the liver looks like. And this was an MRI scan of her liver, which indeed showed that there was cancer in both lobes of the liver. Now here we have a cancer in one lobe, about the size of a baseball, with other cancers. And I explained to the patient and her family, she had a powerful advocate in her husband. Everybody needs an advocate or we're not going to go the distance. And basically I explained the situation, and the husband said to me, "Why don't we operate?" And I explained why this is typically not done, but he was very persistent, very appropriately persistent. So in deference to this spouse, we asked the liver team to visit with the patient. And the liver team said, typically we do not tackle cancer in the liver when it's in both lobes, but you're young, you're fit, you have a support system. Let's see what we can do. So over the course of about 18 hours, a surgical team tackled the liver and amazingly removed 99% of the patient's cancer. This would have been unthinkable if the spouse had not raised this situation. So let me share with you the pathology report of what it looked like after the cancer was removed. And what we found, that 99% of the cancer was removed. And if I could just touch on the pathology report, there were masses up to 7.8 centimeters. A baseball is 5 centimeters, and almost all of the cancer was removed. So because of the persistence and advocacy of her spouse, we have a whole different ball game, and maybe the patient may be cured. We don't know yet. So we have to be our own advocates. Now let me tell you another fascinating story. One of my friends and neighbors is a very prominent interventional cardiologist. He's the big dog, one of the best in the business. He could put a stent in a ferret. Now, I'm sure there's a ferret lobby in the audience that's going to get upset, but he could put a stent in anything. Comes home from work over a number of weeks, and his wife said, "You look lousy." She used some other hyphenated expletives, but I won't go into that. And he was falling asleep at 4 o'clock in the afternoon, and she said, "You better go see your primary care doctor." So he sees the primary care doctor, and he says, "Yes, you do look lousy. We better do X, Y, and Z." And indeed, he was anemic. They did a bone marrow test, and he was told that you have acute myeloid monocytic leukemia. You need induction chemotherapy, a transplant, and total body radiation therapy. He was dumbfounded. He then brings his wife back to the next consultation, and the blood team says, "Yes, you have leukemia." And the patient says, "I've never had radiation. This doesn't feel right." And in the room, there was a young resident from Eastern Europe. And the young resident didn't feel comfortable with sending this colleague off for a bone marrow study. And the young colleague took it upon himself to analyze the world's literature, both in the Western world and also in the Eastern community, and he came upon a finding which most of us never think about. Frankly, I was not aware of this myself, but Dr. Mesa is. There are a few cases in the world where if we are deficient in copper, our bone marrow looks like leukemia. Nobody thought about this except for this young colleague from Croatia who had the initiative to take it to the next level. Frankly, this was not something most of us are aware of. For my colleague, he's been replaced with copper. His bone marrow is virtually normal, and his studies are looking the way they used to look. So here we have an example of we need to be proactive and take care of ourselves because we have no assurance that the system is going to be with us. Now, before I forget, I just want to go back to what Paige Underwood talked about. I'm the first physician at Mayo board certified in hospice medicine and palliative care. It's a calling, it's difficult, but it's something I'm supposed to do. For the last 2 weeks I was on our service, 50 terminally ill patients, tough stuff. Not one had a will, not one had an advance directives, and no one wrote down the name of their proxy. So I would ask you, before you leave this room, on the back of a napkin, on the body part of your partner or someplace, write down what you want if things don't look good, and write down the name of that person who will speak for you. Because if you don't, it becomes a disaster. I'm dealing with first wives, second wives, girlfriends, same-sex partners. You can't make this stuff up. So write down who do you want to speak with you, okay? So let's take this one step further. This is an MRI scan, and I just want to point out a couple of things here. And I think we can point out this is one lung, that's the other. And you can see a white spot about the size of a fist, and that's cancer in the right lower lung. And I think you can see a rectangle which looks like ivory. Okay, this was stage 4 lung cancer, cancer which had spread from the lung into the patient's spine. And I saw him and his wife and his daughters about every 3 to 6 months for many years. And I see him about 6 months ago, and he had shortness of breath. And he had a number of evaluations, and he needed an aortic valve. And this would have improved the quality of his life. So the aortic valve team, we have teams for every part of your body, whether it's the right knee, the left knee, your toes, we have a team that will replace it. So the valve team called me up and they said, you know, Dr. Creagan, this patient has stage 4 lung cancer. We don't think this is the right thing to do. Well, then I remember telling my colleagues that the date of this biopsy on his chest, August 12, 2012, he's been alive 5 years with this condition. He looked better than half the doctors taking care of him. So what I'm saying, we need to think creatively and have an advocate because medicine is in turmoil right now. Okay, so we're coming down the home stretch. You're killing me, folks. This is like working the Zulu Lounge at the Bellagio. So what are the 3 things we need to know as we're coming down the home stretch, okay? We have to alter our own reality. Things may not be the way they seem to be. We have to take care of ourselves. So there's 3 questions we need to ask to your next medical encounter. Okay, number 1, what's the diagnosis? Are you completely confident that this is X, Y, or Z? And one can do this very respectfully. Number 2, are we certain that this is the problem? And how certain are you that I have whatever? We need to speak up for ourselves. And equally, could this be something else? And if we ask these 3 questions and we're satisfied, we know we're heading in the right direction. And despite what the good book says, the meek do not inherit the earth when it comes to our own health and well-being. We need to be our own advocates, or we may not reap the benefits of the tremendous successes that we're seeing. So on behalf of all of my colleagues and all of you who are survivors, this has been a privilege and honor to be here. God bless all of us in our country. Thank you very much. Thank you.